attention that you are participants of the historical event. That is the first time in the history of medical faculty that we are holding the English-speaking conference. Greeting to all of you. I think no need to speak for a long time. The scientist, the founder of histological department in Semyon Nagardon, about some similar situation. Pay attention that she was, how to say, a corresponding member of Scientific Academy of Russia. Corresponding member in this country is some position between professor and academic. That is higher level of scientist. So she said to me that if I'm understanding somewhere 20% of those which are reporters speaking about, I consider that I've understood this report. Give some opportunity for welcome speech to another part of our organizing committee, Svetlana Ivanovna Pavlova. And I think that she has some surprise, little surprise for you.
So I'm very glad that Sergei Vladimirovich invited our department teacher and me to invite this conference. And these words are also a surprise for me. But all of you know that our university and medical faculty have more than 2,000 international students, medical international students. And I think it is a very important inter-subject, interdisciplinary conference, and inviting second, third, fourth, and sixth-year students together. And I think it will be interesting for all, and I ask you to give a lot of questions and do not afraid.
He is Dr. Naman Patel.
Sir, I scored 187 marks in FMG 2023 January. Sir, it is Chuvash State University, Russia.
Yeah. So, why did you become a doctor, Naman?
Sir, actually, there was, I really wanted to become a doctor from a very young age, because there was this family background of a lot of doctors here and there. And sir, also there was one thing that I didn't want to sit in long queues. I thought that if I won't become a doctor, I'll be sitting in long queues and be waiting for.
Ladies and gentlemen, warm greetings for you for all the day. I really believe that medicine is not only a science, even physiology. It's an art. Since that we believe this word, I really have this opportunity to suggest to Dr. Kuprianov to give this flowers which has been grown, and right now we really smell this fantastic perfume from it. So I really would greet all of you to be here, and I'm so proud of this university to accept these suggestions, especially for English speakers. So I would always suggest good things for you, and to be here, welcome them really so much. And as well for Dr. I hope that you will enjoy the words and you will get the knowledge that we hope and we expect from you to do. Thank you so much, guys.
Have a good day, everyone. Research at the Office of Iron Deficiency and Cognitive Functions and Neurobehavioral Disorders in children studying in Ganesh Municipal Schools. According to statistics, a quarter of world's population suffers from anemia, where half of total numbers of cases are people with iron deficiency anemia.
So my name is Sakshi Bhardwaj from M1521 20AH. So my topic is the physiological effects of yoga. Next, abstract. Yoga is both an art and a science of living beings from ancient India. In today's world, we are facing stress, anxiety, mental load, which leads to lifestyle disorders. Yoga does not only cure many diseases, but also prevent it. And it also affects different systems of the body.
Aspergillosis is the first lung glucosis in frequency. Aspergillosis is found in sulfur springs and even distilled water. Most often the disease is provoked by fungi Aspergillus fumigatus. In recent years, there has been a multiple increase in the frequency of lung aspergillosis. When preparing the treatment on this mycosis, it is necessary to take into account the
By
full
describing
picture
clinical
of the disease.
cases, we contribute to the development of the most effective treatment methods. Since it is necessary to find a treatment that will be correspond the maximum number of factors and variability of course of particular disease. The purpose of our study was to study the clinical case of aspergillosis to trace the dynamics of development, treatment, to identify and study examination methods for the diagnosis of this mycosis. The clinical case to study macropreparation of biopsy material and analyze the variability and effectiveness of treatment with glucocorticoids.
Also called the atrial reflex. At first, what is the reflex? It's the autonomic response for the stimulation from outside or inside the environment of body, and don't reach to, it's doing before reach to the brain. And the experiment it's doing did by physiologist Arthur Benbridge. It's England physiologist, and it's
adaptation of an organism to constantly changing environmental conditions require a wide range of functional opportunities. Good morning to one and all present over here. A very warm welcome to my report. Today, I would like to present the topic, power and frequency characteristics of the cardiorespiratory system in the minimal physical exercise. Scientists have established a close relationship between cardiovascular and respiratory system using modern techniques. Scientists have studied functional indicators using different various experimental influences too. Functional systems. Academician P.K. Enochen sustained the concept of the functional systems. Functional systems are the self-organizing, self-regulating, ironic, dynamic, anatomically both cardiovascular system and respiratory system are different.
Today I am going to tell about the role of components of the cardiorespiratory system. So the researchers named Schulroof, Shilko, Litwin, Fletcher and Woodcoe, they conducted a research in cardiorespiratory system, and they call out several people to conduct this research, and they used a bicycle ergometer for this research. Now the bicycle ergometer is a device which is used to measure amount of air flowing in and out of the body, and thus the tidal volume, and also cardiovascular components like the heart rate, the systolic and diastolic pressure too. And so these people were made to pedal at 40 pedals per minute. In this slide you can see a result table and a spirogram. So in the result table you can see the tidal volume, the respiratory rate, the respiratory minute volume, and the heart rate, systolic and diastolic pressure. The researchers carried out this experiment at 3 different levels. Level 1 at rest, level 2 at 25 watt and level 3 at 50 watts. So the tidal volume during the first set was increased from 0.49 liters to 0.63 liters. That is an increment of 29% in tidal volume. Again, then the respiratory minute volume increased from 8.99 liters to 9.92 liters. So there is an increment of about 10% in the respiratory minute volume. But as you can observe in this table, there is a decrease of the respiratory rate from 18.4 movements per minute to 16.14 movements per minute. So basically from this table we can observe that there is an increase in tidal volume and respiratory minute volume, but there is a decrease in respiratory rate. Also we have a spirogram over here. In this spirogram you can observe that the respiratory amplitude is increased, but the respiratory frequency is decreased. Moving on to next slide. In this slide we have a histogram. The left histogram is at the level 1 load, that is 25 watt, and the right histogram is at the 50 watt. In this slide you can also see the similar results which we get earlier, like the tidal volume was increased, the respiratory minute volume is also increased, the respiratory rate is decreased, and the other components of cardiovascular system like the heart rate, the systolic pressure and diastolic pressure are increased, but only to a lesser extent. And same results we can see in the level 2 load, and there are no such big differences in level 2 load. Moving on to next slide. So basically the result of this research was that in minimal physical condition, the stimulation of external respiration is achieved through increase in amplitude of respiratory movements while the frequency of respiration decreases. Previously in Chuvash State University, Professor Agat Ganyan and Professor Kopriano did an experiment on cats, and they injected lactic acid into the cat and they observed baroreflexes and chemoreflexes of the cat vertebral artery, and then they also found the dominance of respiratory component over the cardiovascular system in the cat too. So as you can see in this graph, the respiratory amplitude, as you can see, is increased, but the respiratory frequency is decreased. Also, when the researchers put the lactic acid into the vertebral artery, at that moment only the amount of blood pressure increased. But as soon as this lactic acid injection is injected out, as you can see, its effect is negligible, then it comes to the normal value again. So this proves that these reactions of cardiorespiratory system in humans as well as animals came out to be similar. Finally, the conclusions. In conclusions, firstly, in minimal physical condition, in minimal physical exercise, the respiratory component of the cardiorespiratory system domination was proved to be more effective and more dominating. Second, arterial pressure and pulse rate react least. And thirdly, the result of this research in humans as well as cats came out to be similar. Thank you. Questions, please.
First questions.
Oxygen. But when we first think of this, we will think that we are breathing more faster. Like we are physically training, so we will think we are breathing more faster. But actually, this research shows us that in minimal physical exercise, there are no increasing in breathing. There is an increase in amplitude of breathing, which gives us more oxygen. Yes.
Actually, I have two questions for you. The one, like, more important to us, if you can return, please, back to yes here, the increasing of the the tension of the blood. after like injection the lactic acid. Can you please tell us about the reason? Is it like a shock value or something else you may tell?
Basically, when we are researching on humans, we can make humans exercise more, like exercise on a bicycle. But when we are experiment on cats, which is animal, so we can't put a cat on a bicycle ergometer. So, but we know the idea. Basically, what we are doing to humans is, when we do exercise, our body needs more oxygen. Basically, perfectionally, our muscles need more oxygen. So what they do is, instead of doing aerobic respiration, they perform anaerobic respiration. And as we all know from biochemistry point of view, that in anaerobic respiration, the result is lactic acid. So basically, we are putting that lactic acid into the cats.
Great, brilliant. Second one, can you please tell us about the main point to use this term as cardiorespiratory system, since like it has like a special touch in Russia. Can you please tell us about the this term, how it like starts, and like 2-3 words from this one, please?
Basically, we can't think of a single system working in our body. I am talking right now, most of the system are working together now. If I am eating, not only digestive system acting, but other system perform too, like my respiratory system will also work. So basically the idea which the researchers used here is that when we are training, when we are in physical exercise mode, our respiratory component and our cardiovascular system are simultaneously working each other. So they want to know about why only one component is dominating over the other. So they use the cardiorespiratory functional system.
Thank you so much, Pradeep. Thank you. It was
Questions?
More questions, please? Thank you.
Thank you so much.
Have to know about 4 basic components of the quality of life. This is about the physical health, psychological health, and the environmental factor, and the social relationship. Our aim is to like analyze the quality of life of the Indian students in our university. For that, we conducted a questionnaires and analyzed the survey reports, and we draw the conclusions, and we will discuss the management. So our approach is to like continue our research. Our approach is to analyze our survey reports on the basis of 4 parameters. As we discussed about the psychological health, physical health, social relationships, and environmental factors. The quality of life grossly, overall, between the first course and 5th course. And here we find approximately like most of the students, they have good quality of life. But in first course, we get little negative responses. The first course versus the 5th course. Our analysis reflects that the 5th course students, they have the more psychological disturbance, or we can say the poor psychological status as compared to 5th course. Because that there is no significant difference in between the physical health, social relationship, and the environmental changes. But although we get some negative responses from the first course from the beginning slides, but these are not the major significance in the statistically. So statistically they have no changes. And the 5th course students, I already mentioned, they have the poor psychological status due to academic stress and licensing exams. That's why they have lower index of psychological status. And the girls are more sensitive towards the academics load. That's why they have poor psychological status. How we can manage the stress? For the managing stress, we should follow, as we like listened everything about our previous researchers, they already mentioned about yoga, daily exercise, and making timetables. These can help to manage their stress level. If the stress level is more high, the students can consult the psychiatrist or maybe follow the psychological therapy or psychiatric recommendations. But best way to release the stress is to make a schedule or follow a daily routine. It can decrease the stress. Thank you for your attention.
And the periodontal ligament is present between alveolar bone and the roots of teeth. and any dysfunction of this periodontal ligament after eruption or teeth loss, it may cause absorption of periodontal ligament. And this,
my dear colleagues, today me and Yaro are going to represent our topic, an interesting topic about warfarin dose based on pharmacogenetics, especially in Chuvash state patients. So evidence-based medicine, it means that we give a special dose to the individuals, depends on their genes. So in genetic and drug metabolism, some genes can cause poor metabolization in some drugs. So poor metabolization will lead to potential toxicity. And normal metabolizers, I think those who like us, they metabolize the drugs in normal rate and speed. And we have also, so our study based on warfarin drug. So warfarin, it works by inhibiting an enzyme called vitamin K oxidorreductase. In other words, it's called like CORS1. And it's most accessible and oral anticoagulant, as we know. And metabolized in liver by cytochrome B450, especially cytochrome B9 to C9. They had warfarin dose here 25 milligram and here 3.75. But in first patient, complication was thrombosis in aortic procedure. And in second, it was extensive bleeding, which is the opposite. So why it's happened, will we know from here.
Thank you, Abdulaziz. So now let us discuss why such strange complications happened in both patients. Can you give me the
laser?
Yes, why such strange opposite complications happened in both patients, both receiving the correct dose of warfarin according to their INR. Patient number 1 had thrombosis, patient number 2 bled. Before getting into the complex genetics, let us first discuss some environmental factors. For example, age. Patient number 2 was 20 years older than patient number 1. And some other factor, history. Patient number 1 was a smoker, 26-year-old smoking history of 10 cigarettes per day. And as we know, smoking induces cytochrome P family. Induction of cytochrome P family increases metabolism of warfarin, decreasing concentration of warfarin in the blood, leading to bleeding. In addition to some minor effects due to some drug-drug interactions, both patients took warfarin in addition to a nice package of antihypertensive drugs, and we know drug-drug interactions exist. For example, both patients took spironolactone. Spironolactone is a diuretic. Diuretics lead to hypovolemia. Hypovolemia increases the ratio of coagulation factors in the blood, leading to coagulation. In addition to one more drug, atorvastatin. Atorvastatin competes with warfarin to be broken down by cytochrome P family. This competition leads to increasing of warfarin concentration in the blood, leading to bleeding. But these factors are minimal. Let us now discuss the major factor, the major topic of our today's presentation, which is genetics. Both patients underwent a genetic test for cytochrome P2C9 gene and of course C1 gene, and these were the results. Patient number 1 had a wild type for cytochrome P2C9 number 2, 3, wild type in both, and I will explain now. Wild type is normal. Patient had no polymorphisms. Also, in of course C1, patient had GG, wild type, which is associated with decreased sensitivity to warfarin. By this website, you can calculate an estimated dose of warfarin depending on the patient's case. So in conclusion, as a doctor treating a patient, in general, pharmacogenetics exist in all drugs, but especially in warfarin, it's very crucial. As a doctor, you need to take care while giving a dose of warfarin. You need to understand the patient's genetic might lead the patient to deal and react to warfarin differently than other patients. Thank you very much.
I said that it is the first
English speaking conference in the medical faculty from according to the whole history. Thanks for all persons, all you friends who are sitting here and who not only make reports but attentively listen and actively discuss all these things. But the work of our conference is not finishing. I'm asking for organizers, organizers firstly, mainly, Svetlana Ivanovna, not to be free. We are not free. We need to discuss results. So our decision of today's conference results, with no comments. Of course, all of you ready for a prize, but we have only three prizes, three main positions, and our decision is the following one. First place is Pradeep Jain. Second position, Mohammed Abdelaziz, and the third position is Shakti Chadhan, one of our most active students. Thank you. One more time. Thanks to all of you. Everything will be from your side is great or were great. See you maybe on our next conference.
Yes.
After on the next year.
Thank you.
Thank you so much.